Welcome back to Bahamas at Sunrise. Of course, you know that it's National Youth Month, and of course, it's also Older Persons Month. But did you know that it's also Audiology Awareness Month?
Yes.
Very pleased this morning to have the teenager. I'm just joking with her this morning. Dr. Treasure Kenny, audiologist at the Family Medicine Center. Good morning again. Welcome to Bahamas at Sunrise.
Good morning. Thanks for having me.
Sorry about that youth parliament thing, man. I just was. But it's not Audiology Day.
Mm-hmm.
It's an entire month, which means that this is a significant thing.
Yes.
Why?
So it's Audiology Awareness Month, like you said, the month of October, deemed by the American Academy of Audiology. And it's just all about bringing awareness to hearing loss. So we want to stress the importance of what we do as audiologists, and then we also want to stress the importance of protecting your hearing. So it's also National Protect Your Hearing Month as well.
So is it a significant, is it prevalent, around the world and in the Bahamas?
Yes, it's actually very prevalent. So when we think about chronic diseases among older adults, hearing loss is the third most chronic disorder after heart disease and arthritis. And this month is important too because we just want to bring awareness to get your hearing tested. A lot of people, it's something that's gradual, and only 20% of people actually seek treatment for hearing loss.
Right.
So a lot of people kind of ignore it.
And you say hearing loss versus hearing protection. There's a difference?
Yes. So good hearing health always starts with protecting your hearing. So for instance, noise-induced hearing loss, which is a common cause of hearing loss, is 100% preventable. So, we always want to bring awareness for people to start there to avoid that cause of hearing loss as well.
And it's not as simple as saying something's too loud.
Exactly. It's not as simple as saying that. You may be surrounded by very loud noises. In fact, over 85 decibels and above is when sounds really start to become at a dangerous level. So that can be anything from, it's a little bit louder than traffic noise. So anything that we work with on a daily basis, such as lawnmowers, drills. Let's say we work at the airport. We're exposed to jet engine noise. So you definitely want to.
You can't take it for granted.
Exactly.
So when should somebody test for hearing?
So in terms of getting your hearing tested, so for kids, you definitely want them to have a newborn hearing screening. You want them to get their hearing tested before they start school and then every couple of years once they're in school. Just because sometimes hearing loss can develop over time. And then once you become an adult, you always want to get your hearing tested about every 10 years or so.
Really?
Yes, sir.
Man, I'm a couple of decades short on that.
And then even as you get older, so over the age of 45 to 55, you want to get your hearing tested or screened every 3 years. And then if you find that you're having difficulties hearing, you definitely want to come in right away so that we can test your hearing and see what's going on.
What would cause, besides the loud, what causes hearing loss?
So there are a lot of different causes for hearing loss. It can be something as simple as too much wax in the air, for instance, or an ear infection where there's fluid behind the eardrum, which may make things muffled. There's also viral infections of the inner ear or diseases of the inner ear that can cause hearing loss. In addition, you may find that you may have a family history of hearing loss that may put you at risk for developing hearing loss later on in life. There's a lot of things. Even if you take medications, for instance, like aspirin in high doses, or let's say you are taking chemotherapy treatment and certain drugs can cause high-pitched hearing loss, for instance.
Wow, interesting. How do you treat it?
So the common treatment for hearing loss are hearing aids or hearing devices, and also cochlear implants for severe to profound hearing loss. So like I said, a lot of people do not seek treatment, but hearing aids today are very small. They're very cool, very advanced. So they're this small, and they have a computer chip on the inside. So they're constantly analyzing the environment and determining the automatic adjustments to make.
It's interesting. I was giving you an example before we started about with my son and glasses, and the fact that we didn't quite know that he was having a challenge with his sight until he's just right up on the TV and it's like, get away from the TV. But eventually it's like, oh wow, he really has a challenge with his sight. What are some of the signs related to hearing loss? What should somebody be looking out for or listening out for? I don't know.
Yes.
Yeah.
So some signs for hearing loss, so like we discussed earlier, if you notice that you have ringing, about 80 to 90% of people that have hearing loss also have ringing. Some other signs may be, well, a lot of times other people notice that the person has hearing loss before they do.
Right.
So they may complain that, you have the television up too loud, the radio up too loudly. They may also notice that they're not quite catching on to the gist of the conversation. And then you have the person themselves. They may complain that you're not speaking up loudly.
Say it again.
Exactly. You're mumbling, so they're going to ask for repetition as well. So those are really some of the common signs.
The test itself, because now I'm really interested in this, is it just a quick, what does the test involve in terms of hearing?
So it depends on your age. So for kids, they obviously around 6 months to 2.5 years. They can't tell you exactly what they're hearing. So we put them in a sound booth, and then there are toys mounted to the booth. And so we kind of present the sound and play a light up toy when they hear the sound. So they kind of turn to it. And then there's also playing games with children that are a little bit older. And then traditionally, so we test your hearing via headphones or insert earphones over a range of pitches. So we look for the softest sound that you can hear. And then if you come in and you tell me you have issues with background noise, I may do a speech and noise test to see how well you hear in a noisy environment.
And that's for adults?
Yes, sir.
For adults. Okay.
Yes.
Interesting. I gotta love it. Shelley, we gotta, can you hear me now? I mean, I'm talking to you. So let's, listen, Treasure, thank you so much for coming here on Bahamas At Sunrise. If somebody's interested in just reaching you, how can they?
So I can be reached at Family Medicine Center. So I do full comprehensive testing for children at 6 months and up, and adults as well. And Family Medicine Center is located on Blake Road.
Okay. Thank you so much.
All right, thank you.
All right, Dr. Treasure Kenny, audiologist, Family Medicine Center. You're watching Bahamas At Sunrise. We'll be right back.